Hey, this is Tanner and Peyton of Rags and Riches.
And you're listening to the Nonsense Chronicles with Doug and Rob.
Hello and welcome to the Nonsense Chronicles. This is Doug Sashery, and as always, I am joined by
Rob Mendiola.
Greetings, Rob.
Greetings, Doug. How's it going, man?
It's a good day, man.
It is a good day.
It's a good day. One last cold day of the year, maybe.
Maybe, yeah.
Yeah, snuck
Well,
up.
it's Texas, man. You never know.
Yeah, I know. God. Speaking of cold,
Speaking of cold,
that's right. We have
we got some cold business today.
we have Dr. Andrew Doe of, and I'm going to get this wrong. Is it Calisthenics? Tell me, Andrew.
Calisthenics Club of Houston.
All right, and y'all specialize in?
Calisthenics, and we also have contrast therapy, cold plunges followed by sauna.
Nice.
Good deal. And yeah, I'm a big proponent of cold plunge. If you would have asked me this, and I'm trying to convince two friends, in fact, right now. If you would have asked me this years ago, I would have said, "Yeah, are you out of your mind?" But somebody got me to try it. I think right after COVID or right during it, kind of people started putting videos out, and people have done that polar whatever forever, but started getting kind of popular. And for me, with like lower back pain on my after I run, my thighs are just, and my hips might be bugging me. I go in there, what I was told, and Andy might tell us completely different, but for what I was told was do one Tom Petty song, which Tom Petty and Mike Campbell said 3 minutes and we're out. That's so I do one Tom Petty song, and I get out, and I can tell you this: compared to if I get a massage, which is really good and it lessens it, you get in a cold plunge, and I don't know if it's inflammation, and Andy can help us on this, but inflammation and everything else, it's gone. And I mean, like the next day, I may have a little bit of residual, but I have nothing. When I'm talking about just, look, I'm a 58, getting ready to be 59-year-old man. That's going to happen regardless. But it totally takes away all of that pain, all of that tightness. It is gone immediately, And I had some friends that when we were at the hotel, they were looking at me like I was crazy. I'm like, hey, you do this one time, and you'll love it. But Andy, why don't you tell us a little bit about yourself, man?
So I'm a physician in the Houston area. I own a couple of clinics, treat mainly vascular disease, and I've always been an athlete my entire life. And, obviously, like you said, as we get older, we get a little, lingering injuries and tend to get injured more often. So just looking at some kind of, alternative treatments versus the typical pain medicine, anti-inflammatory, things like that. I started looking at cryotherapy and all this cold therapy. And when the gym came along, we decided to add the contrast therapy because more and more studies are showing the benefit of this cold water therapy or cold therapy in general. Now, when you mix it with some warm water or warm air, as we do in the sauna, the benefits tend to be even greater. And, there's things to the degree of a man swimming the length of the Willamette River and curing his cancer. We are just starting to understand how this cold therapy affects us. For years in medicine, we've been taking patients that are having heart attacks or brain injuries, spinal cord injuries, and chilling their body. And we definitely know there's less injury, less inflammation, and better recovery from this. So if we just extrapolate it to our everyday, being active, living a normal life, this helps us recover. This helps us stay more active, stay more healthy. And we can see within the blood, we can see markers of inflammation just dropping when we do this cold therapy, especially when we do it on a regular basis.
That's fantastic. Yeah, and I always, look, I'm no doctor, but I attributed it to what happened with me is I had to get a gallbladder removed, and when they went in, before they went in, the gastrologist looked at me and she said, "You have a fatty liver too." And see, I had dropped. Now since then, I've dropped like 78 pounds. I went all clean diet, but the a big thing about it, the fatty liver. I know one thing I know I do, and as I've gotten older, and those little nicks you took when you were younger, they come back to visit. I take. I was taking. I mean, I would take a couple Advil. I don't take any other meds. When I've had the surgeries, I never took the pain meds. I stayed off of them. But for some reason, I know that Advil is not that great to just keep taking. And I would take. There would be days where it might be 8, 9 days in a row where I would take 2 in a row, and sometimes I'd have to take 2 more later that day. And that I know. I'm pretty sure that you can tell me that I'm pretty sure it's not good for your liver.
No, not at all. Especially if it's chronic and over a long period.
Yeah, and that's so when I got into doing this, it was to get rid of taking anything and like I would say, well, instead of doing that, then I'm going to go do a plunge because I could feel immediately. There's a big difference between, massaging a muscle and then, putting it in that and getting rid of that inflammation. And I could feel it in my body, and I'm lucky enough to have a in-ground hot tub. And during the winter before I won't heat it, but in the morning I'll go and I'll get in that thing. And you talk about, it just highlights your day. Now, there's a difference if I'm doing just my back, if I'm sitting in a short tub where it's, I'm 6'3", so I'll make sure I get my back down. But if I go down in my hot tub, that's when you have to do some breathing, to get right in that tub, as I'm sure you know.
Yeah, and that's one of the other kind of, I guess we call it a side effect, but a beneficial side effect. And a lot of people say, hey, I don't want to get into our cold plunge. And we actually made it a point to get the best model on the market. And ours is 37 degrees Fahrenheit. So it stays nice and cool. And one of the other things, if you get in an ice bath, a regular, big plastic tub full of ice, you can just sit in there and not move. And your body will actually build a thin layer of insulation around your skin. Now, in order to offset that, you can either move or you can do what we did and get a cold plunge where there's jets constantly cycling the water so you stay cold. But the nice side effect of it is you need to be able to control your breathing, you need to be able to kind of go to your happy place, and it actually helps you become much more mentally tougher, and it helps you control, that kind of terrible place and get through it. And it's really beneficial for a lot of people we've had that were like, I don't think I can do that, and then slowly build up to a 3-minute cycle, and all of a sudden they're like, wow, I can't believe I did that. And you can just see the confidence boost and everyone, kind of benefiting from that.
Yeah, I think once I'm in that initial shock, and I'm talking about like mainly it's just legs. Once you get the initial shock of going in, then once I sit down, it's pretty much over. And I have headphones on, and I mentally just check out. I know it's only going to be 3+ minutes. I don't know what y'all do it for, but it's funny you said the heat. I usually do the sauna before I get in there, like when I go to my club. So yeah,
there really isn't a set way to do this. Lots of people have different protocols. Personally, I like to do the cold first because that's the least enjoyable part. It's easy to sit in a hot sauna, especially you live in Houston.
Yes.
So, but what we do advocate for is 3-minute cycles and then sauna in between the cycles. And then the length of time in the sauna really doesn't matter. Probably need to be at least 5 minutes to kind of offset the 3 minutes of cold. But usually about 10-15 minutes in the sauna, 3 minutes in the cold plunge, and then back in the sauna. We do that 3 times. And that's pretty much been the cold aspect of it, the cold therapy. That's pretty much been researched pretty well, and that seems to be a great amount of time to be in the cold.
Yeah, that is fantastic. Yeah, and y'all cycling it like that. That's really good. I don't know. Is there any way to measure the? Has there been any studies to measure the loss of inflammation? I guess.
Well, we have good studies that show that there's much less cortisol And most people will say after a good cold plunge, they sleep really well. And that's, again, probably that cortisol level being decreased. We do see some decreased activity, especially when this is researched in cancer patients. We see decreased T cell activity, which is your immune cells, which is good. We see increased T cell activity, which is good because it's fighting the cancer. And we also see decrease in what's called cytokines. And those were the nasty things that made COVID so bad. You got what's called a cytokine storm, and your body got so inflamed and just so terrible everywhere that people would succumb to the COVID. And we do have good studies showing that these cytokines are definitely reduced with the cold plunge.
Yeah, I got Rob's sitting right here. He did a involuntary 3-month nap because of COVID, and then he woke up and spent 3 more in the hospital. So he's one of those. I think probably with the well, you know better than I do, but I think when they come out at the end of the day, I think it's blood type mess with a lot of people that I knew. Depending on what blood type you had.
Yeah, there was some genetic component to it. Certain people were barely affected, and certain people obviously, are no longer with us. So,
yeah. But yeah, that's. I tell you what, I think it's fantastic. I think. When did you know that? When did you get into it? Because I know that's something you've branched off into. When did it draw you in?
So actually, the biggest thing, similar to you, is a low back injury. And, massages and stretching and all that stuff was great. And one of the doctors I worked with said, "Hey, why don't you put an ice pack on?" And I thought, an ice pack on my back? That doesn't make any sense. It's not like a finger or something that just got slammed in the car door.
Yeah,
or
it's too small.
hit
I
it
agree.
on the curb or whatever. And all of a sudden I was like, wow, that really does help. So then I started to look into other stuff like cryo chambers, and I did that. And just like you, I noticed probably 80% reduction in my back pain. And, just kind of progressed from there. Having a cryo chamber is a little more logistically challenging. Can't have it outside. It gets so cold you can really injure yourself. That's what happened to Antonio Brown.
Yeah.
He stayed in the cryo chamber and refused to put socks on
Oh, God.
and almost lost a toe. Yeah, he almost lost a toe, and almost lost his NFL career. But with the cold plunge, because it's obviously not below freezing, you can tolerate much longer time frames, and you can get much more of the benefit. There's even been studies that show, you may only need to be 50 to 60 degrees in the water, but
Right.
still, we know it's these. I don't want to call them newer therapies. I want to call they should be these ancient therapies. Back when we didn't have a pill for everything, they had to try different things, and they would chill you when you had a fever and things like that. And it's just kind of this rebirth and this kind of treatment without medicine or without medications that we're really starting to see bloom. And this is one of the great things. If you know anything about animals, the possum cannot get HIV because their body temperature is too cold.
Wow.
It won't live in there. They don't get cancer because their body temperature is too cold.
Mm-hmm.
There's a lot of this temperature benefit and this temperature response that we're seeing with, diseased and healthy states.
Wow, I did not know that, and that's I think the not feeding on that damn Advil when I would wake up or before I would go to bed is a huge thing. If I have to take it still, I will. But I mean, if it's that or a cold plunge, look, I'm doing a cold plunge. It's going to be better for my liver and everything else in the long run.
So how long before your body starts becoming hyperthermic?
Well, you would have to be, probably somewhere in the 5+ minute range, which is why we say don't do more than 3 minutes at one time. Obviously you can do 3.5 minutes. It's probably not going to be an issue, but, and it also depends. You probably get the same benefit without putting your feet and your hands in. But if you do that, then you probably want to be closer to that 3 minute mark, just because as we get colder, We may not think so, and I don't think so
Yeah.
because I'm a surgeon. I need my hands, but your fingers, your hands, and your toes are not as important as your brain and your heart. So your body will clamp down the blood flow to those, and that's how you end up with frostbite and losing, fingers and things like that from the extreme cold. But as long as you stay around that 3-minute mark, that's probably the best thing to do.
Yeah, I love it, man. And where can people research more of this on their own? I mean, is there somewhere to send them?
There's a lot of data out there.
Yes, you can. Yeah, there's tons of data you can try. I tried to summarize it as best I can on the website, Calisthenics Club of Houston. Actually, I think it's Calisthenics Club Houston. And, we have a good section on there. It's called contrast therapy. Some people call it fire and ice. Some people call it Nordic therapy, but it's all essentially the same thing. And you can go on there and get a good synopsis. And then, like you said, there's a million articles out there. It's a little tough to try to sift through what's rigorous and what's garbage, but I try to summarize the good stuff on the website.
Yeah, I read everything from like it kind of puts you in a fight or flight situation with your cells molecularly, and it helps shed bad proteins from your cells. Man, there's just so much.
Yeah,
stuff out there.
the big thing is inflammation, and we know all the inflammatory markers we have now, and some of the things you're speaking about, those are inflammatory markers. We know it decreases those.
Yeah, that's pretty cool.
Yeah, I mean, like I said, for me, it's that lower back to the hips to the top of the thighs, that area there, and it's night and day. And if I go in for the during the winter when I go in for the up to the chest, you have to get your breathing just normal. And I had read a lot about that before I tried it, and man, your whole body, you're ready to run 1,000 miles a day. That's how good it feels, and. It's a huge difference. And then, like I said, compared to any time you can avoid taking some kind of chemical into your body, Advil, anything else, I'd suggest that do it, man. Your body's going to be so much better.
Is this considered alternative medicine?
It's kind of in this quasi mainstream alternative kind of area. Because, like I said, we've known for a while now for neurologic spinal cord brain injuries and heart attacks. We know cooling the body really does help. But, using it to treat cancer is probably still considered an alternative medicine. But, the overall factor with any of these, old treatments made new, or these new treatments, these cold water therapy, things like that, is you put your body into a stress.
Right.
And you let your body fix it. You don't take a chemical to shut something off. Exactly. And that's the idea behind the alternating warm and cold, is you decrease the blood flow, which decreases the inflammation getting to the injury area, and then you go and increase the blood flow, so anything that's left over gets taken away. So it's kind of when you're in this middle of, normal temperature outside, normal activity, you're not exercising, the inflammation can kind of fester. But once you put yourself in a stress on either side of that, whether it be cold or hot, then your body's got to say, hey, we need to prioritize if we really need to have this inflammation here. Is it really doing any good? And it can turn it down, and it can alleviate it by flushing out those bad chemicals that our body's making.
Go ahead. I'm gonna have to try the cold first technique. Then that's definitely. I would normally go in there. Depend on sometimes how hot it was in there, and if I had to turn it up. But I'd get in that sauna for anywhere from 15 to 30 minutes, depending on where it was at. Then I would get out and then get in the tub. And
is there any risk for complications while anybody doing this, or somebody being administered to do this? Should it be supervised?
Actually, you should be supervised. You should have someone, you should be having a timer to make sure you don't exceed it. But there's actually more risk with doing the sauna than there is doing the cold plunge, obviously within reason. But the sauna, you've really got to worry about hydration status and length of time you're in there, and humidity within the sauna, things like that.
Yeah, because it can sweat you out pretty quick.
Yeah, I know.
Oh, absolutely.
I take
especially in Texas.
I take a 32 ounce with me, and when I'm out of water, I'm
Yeah.
out that sauna. Yeah, that's my rule.
So supervision's
Yeah,
good.
and exactly. And in even being, being a physician and being an athlete and knowing the science behind all this stuff, I still say, oh, I'm going to go jump in the sauna and then do a cold plunge right after I train or, do some kind of workout. And I say, uh-oh, I feel a little lightheaded. I don't think I drank enough water. So then I've got to
Okay.
stop. So,
Yeah, it's just common sense things on training, and just like anything else, when you go to work out, you should be checked out by a doctor and make sure you're.
So if there's any underlying issues like your heart or something, would that maybe be counteracted by doing that method, cold, hot?
well, so this is a benefit for the vascular system.
Okay.
And it does prevent tissue injury, but if you've already got the tissue injury, you may not want to jump in a cold plunge and have your heart rate go way up
Right.
when you don't have a good, so there are some states where we would say, hey, it's probably not a good idea for you to do this, but that's pretty rare, pretty few and far
So
between.
supervision definitely good.
Yeah, I wish we could have.
Absolutely.
So go to your professionals for this kind of
Yeah,
treatment.
I wish
Yeah.
we could have got my soon-to-be 90-year-old dad into this 20 years ago
Yeah,
when
20, 30 years
before
ago.
his veins started collapsing. That would have been fantastic. Yeah, but Andy, thanks so much for joining us today. Please give us, like I said, give us some information. Tell us again where can people go to find out about
And
that?
how much are these treatments? Like, if somebody wanted to go in and do these treatments, like what's an average?
Usually, we have we have a bunch of packages you can buy.
Yeah.
We can kind of price it to any degree. If you want to do it every month, you want to
Okay.
do it every week, things like that. And they usually start, in the $30-$35 range. And
Oh.
obviously, as you buy packages, it gets
Yeah.
cheaper and cheaper.
Very reasonable.
We really want people to do it religiously, because that's when you're going to see
Yeah.
the maximum benefits. Like my wife actually started doing it, and the first time she said, I don't know. And then after that, now I can't. I have to fight with her to go on Sundays to watch it, because she wants to do it and I
Yeah.
want to do it. So,
Well, that's good.
she's
That
really
sounds
bought
reasonable.
in now.
Yeah, it is.
That sounds very reasonable.
It's just to get people to try it that first time.
Yeah.
Because it is.
Absolutely.
Yeah, once you do, like, oh my God, man, yeah, that is so much better, So, give us that information again, Andy, where to go.
So it's calisthenicsclubhouston.com. And if you want to email us, info@calisthenicsclubhouston.com. And then the phone number is 346-483-3195.
Man, I think that was fantastic information today. Andy, thank you so much. And
No problem. Thank you guys for having me.
let me say, this is the Nonsense Chronicles, and we are out of here.
Thanks.
Thanks.